Hi, I'm Liza. I'm going to be doing your physical exam today. I'm going to start by washing my hands and closing the curtain. Can you go ahead and tell me your name and your the date today?
Maya, November 18th, 2015.
And the date of the week?
Wednesday.
And where we are?
Charlottesville.
And the president?
Obama.
Perfect. I'm already assessed her general appearance versus her stated age, her grooming status, and her nutritional status. I've assessed her position, posture, vital signs, and pain, and I've assessed her mental status looking at facial expression, speech, affect. So I'm going to start with the skin. I'm looking at the color, the pigmentation, any lesions, markings, bruises, vascularities. I'm going to feel for warmth, temperature, texture. I'm going to test for turgor. And then I'll go ahead and look at the nails. And I'm going to continue with my skin assessment throughout the exam. The nails, I'm looking at the shape, feeling for the texture and consistency. I'm looking at the angle of the nails if you go like this for any clubbing. I'm also palpating for capillary refill. So next I'm going to do the head and scalp. I'm inspecting the head and the hair for any infestations, the color, the distribution of the hair. I'm going to feel for any lumps or bumps. I'm looking for lesions and looking to see if there's any tenderness when I feel. Looking at the scaling of the scalp as well. Next we're going to move on to eyes. I've got my pen light. I'm looking at the symmetry of her eyes, looking at the color of her eyes, looking at her eyebrows and whether there's symmetry to those and any lesions, looking at the lids, the color, the eyelashes. I'm looking at the distribution, the conjunctiva and the sclera, looking for any weird coloring, or looking to make sure that there's not any discharge, not any tenderness, palpating the lacrimal glands, making sure there's not any swelling or excessive tearing. Go ahead and looking at the pupils, making sure they're even shaping and they both have the same size on each side. And then I'm going to go ahead and test her extraocular movements. So if you could go ahead and follow my finger. Okay, perfect. So then I'm going to go ahead and you just stare straight forward at my nose. And I'm going to look for pupils for a direct and consensual reflex. Okay. And then I'm going to do a test for accommodation by asking you to look at a far distant object. And I'm looking at the pupils. And then I'm going to ask her to shift her focus to my finger. And I'm looking for the eyes to come together and for them to become stretched together. Okay, perfect. So put this down. And then we're going to go with the ears next. So I'm looking for symmetry of the ears. I'm looking to see if there's any lesions, any discharge or swelling. I'm feeling them for the mobility, any tenderness. Then we can perform a whisper test. So I want you to, with your opposite ear, push in and out really fast while I'm doing this. And then whisper 3 words into your ear and then tell me what they are. Okay.
Cat, dog, tick. Clock, 9, tree.
Perfect. You did great. And next, I'm looking at the nose and the sinuses. I'm looking at the symmetry of the nose, the shape of the nose. I'm palpating the skeletal integrity, seeing if there's any tenderness. I'm palpating the frontal and the maxillary sinuses for any tenderness and swelling. And then I want you to go ahead and push one nostril in and out of the other, testing for patency here. So next I'm going to go ahead and inspect the mouth, so I'm going to put on some gloves. Okay, so here I'm looking at the lips, I'm looking at the moisture of the lips, I'm looking at the color, looking to see if there's any cracking or scaling. I'm going to ask her to open her mouth. I'm going to just look on the inside, looking at the teeth, the number, the gums, how they align with the teeth, any lesions on the inside of the mouth. Looks good. I'm just looking at the tongue in general. I'm going to ask you to stick it out straight. That's testing the cranial nerve 12. I'm going to go ahead and take some gauze and feel on your tongue and look to the side. Stick it out and I'm just going to look to the sides of the tongue and underneath the side for any scaling or lesions. I'm also going to look at the roof of her mouth, at the hard and soft palate, looking at the texture of those, any lesions. I'm going to ask you to say ah, looking at the oozle, rise midline with the soft palate. And then I'm going to ask you to stick out your tongue and look at the tonsils and looking at the color and the size of the tonsils. And then I'm just going to feel around the inside of her mouth for any lumps. Okay, so take my gloves off and we'll continue. Next I'm looking at her face in general, the symmetry of it. We're going to test the facial nerve by making some faces. So I just want you to frown, grin, show your teeth. And I'm going to palpate, go ahead and palpate the T&J for any tenderness. Try to open your mouth. It's testing the strength of that. Then I want you to puff your cheeks. Okay, that's good. And next we're going to look at your neck. So I'm looking at the symmetry of your neck, looking at the trachea that's midline, and I'm going to palpate for the thyroid gland. So I want you to take this glass of water, and we're going to swallow while I palpate. And palpating for any lumps and bumps when she swallows. Okay, that's great. Okay, next I want to test your trapezius and sternocleidomastoid strength. So I want you to rise up against me. Perfect. And any tenderness in my palpate. Okay, perfect. Next I'm going to move on to your lymphatic system. We're going to palpate the cervical lymph nodes first, and we're going to start with the pre-auricular, the post-auricular, the occipital, the tonsillar, the submandible, the submental, the supraclavicular, the infraclavicular, cervical chains. I'm going to palpate the axillary nodes. So figures. Okay. We're going with the posterior, anterior, central. Okay. And then posterior, anterior, central. Okay. And then next we are going to do chest assessment. So let me clean my stethoscope. And before we move on to chest, actually, I want to do a sensory test on your face. So it's a light and soft touch. First we'll start with this. This is just a sound. So let me know when you feel it. Okay. And so this is a sharp sensation and this is a dull sensation. I want you to tell me which one you feel.
Sharp.
This is sharp. And this is dull.
Dull. Dull. Sharp. 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 Dull.
Okay, perfect. So we'll move on to the posterior chest. I want you to just turn around. That's perfect. Make sure you don't fall. I'm looking at the skin of her back, making sure that it's symmetrical, looking for the contour. I'm assessing her respiratory rate. I'm assessing whether she's using any accessory muscles. I'm looking at the ratio of her transverse to anterior posterior diameter, the contour of her chest, and then I'm going to feel for chest expansion. So if you can take a deep breath. Beautiful. And then I'm going to go ahead and palpate for any tenderness. And go ahead and do some checking for percussion of the lung fields. Making sure to get the lateral fields as well. And then I'm going to go ahead and listen to her breath sounds. Okay, so just deep breaths. Okay, while we're back here, I'm going to test for CBA tenderness. So just let me know if you feel any tenderness.
No. No.
Okay, perfect. So I'm going to have you turn around to the front this time. So now I'm assessing the anterior chest, pretty much looking at the same thing I was looking at the posterior, the skin, looking for any lesions, looking at the condition, the color of the skin, looking at the contour, the symmetry of her chest. And I'm going to feel for the expansion again. So take a deep breath. Beautiful. So then I'm going to percuss again. Okay, and now I'm going to listen to the anterior lobes. Great job. So now I'm going to move on to my heart exam. Looking at her chest again. I've already examined her skin. I'm going to palpate for any thrills. I'm going to palpate for the apical impulse right under here. Can you take a deep breath and hold it out? Pull out. Good. Then I'm going to go ahead and auscultate her heart sounds using the diaphragm and then the valve. also going to auscultate the apical ankles. Okay. So good. Heart sounds great. We're going to move on to the peripheral vascular. So I'm just looking at the skin of her arms and the legs again, looking at the color, feeling the temperature. I've assessed the capillary refill of her fingers. I'm going to go ahead and assess the toes. For capillary refill, I'm going to palpate for any edema. Okay. And I'm just going to feel her peripheral pulses, starting with the carotid, the brachial, radial. I'll do femoral later. The pretibial, and the pedal pulse. Perfect. All right, so next we're going to do an abdomen exam. So if you just want to lay on the table. So I'm looking at the contour for abdomen first, the symmetry, looking at the umbilicus, looking for any distension, any scarring or lesions. Next, I'm going to auscultate for bowel sounds. Okay. Then I'm going to palpate and percuss. Percussing for tympani and areas of dullness. And I'm going to lightly palpate for any tenderness, feeling any lumps superficially. And I'll palpate deeper for any masses, feeling the outlines of some of her organs that are palpable. Okay. While you're laying down, I'm going to go ahead and palpate the inguinal nodes and the femoral pulses that I missed earlier when she was laying. Okay, great. So next we're going to do some musculoskeletal stuff. While you're laying down, I'm going to have you go ahead and we're going to move your hips. You can put your shirt down. You're going to move your hips. I want you to lift one leg up, just straight up. Perfect. Now bend towards your chest. And I'm going to try to pull on you and you resist. Great. We'll do the other hip. Up and then towards the chest. Pull. Okay, and then if you can just take your leg and kind of go out like this and then back in on the other side. Perfect. And then hang your feet up here and kind of move your leg and your ankle in and out. More like this. Swing your leg. Sorry. And while I'm doing this, I'm feeling for her general muscle tone and inspecting all of her joints down here, the knees, the ankles, feeling the toes for any tenderness or swelling, and feeling her general muscle tone, looking at the shapes of the muscle and the color, any lumps or abnormalities. So next I want you to take your ankle, take it to your knee, and rub it all the way back down. So you put it along your shin. So, and the other side. Great. Okay, so next I'm going to ask you to sit back up and we'll do your shoulders. If you could just go up and down like this. And we're going to go behind. Try to touch your hands together. We're going to go above the head and back behind. And then just kind of out on both sides. And then I want you to put your arms out straight and then kind of push against my hands. And the other way. It's testing the strength of one way to test the strength of our shoulders. Next, I want to test your elbows. So we'll do range of motion of the elbow up and down on either side. That's the strength on either side. And hold out and kind of turn supine and prone. Okay. Next, I'm going to have you stand up. Let's see. And come this way a little bit. I'm going to have you bend your knees. Okay, good. And I'm going to have you walk on your tiptoes towards me. Perfect. Walk regular. Great. And assessing your gait here. I'm going to go ahead and palpate your spinal processes. Go back up. For any tenderness. Looking at the alignment of her back. Looking at the symmetry of her back. I'm going to ask you to bend over, touch your toes. Looking at the alignment. Alright, I want you to twist right and left. And that's great. Now I want you to turn around towards me. Hold out your hands and close your eyes and turn them up. This is pronator drift. I want you to stand with your hands to your side and put your eye closed. This is testing the Romberg. Then I want you to do, close your eyes, have your arms out, touch each finger to your nose. Great job. So then next we are going to do sensory, again, of the extremities. I'm going to, again, feel this, you tell me when.
Okay. Okay. Yes. Okay. 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 Yeah. 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 Yep.
Okay, and then we'll do the sharp and dull again.
Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp.
Okay, great. And then lastly, we'll do your reflexes. Start with the biceps. So this. Okay, elicit a response. Touch your teeth. Okay, so that elicited a response, and then we'll do her knee, patellar reflex. So you can see that both elicit a response on both sides. So that's the end of the exam.